So part of what we study in biological medicine is how the dental picture affects the body. And this chart is so beautiful. This chart was done by a naturalist from Austria, and it is just a gorgeous chart. If you search online for dental Chinese medicine chart, you can find other charts, but this one has, of course, a special place in my heart. So what I want to do is explain a little bit about this chart and what it means to you. So let's start with the front teeth, which will be right here on the body. So the front 4 teeth, top and bottom, are related to, in acupuncture, the kidney and bladder meridians. So this has to do with, obviously the actual kidney and bladder, but your kidney energy is sort of the source of your vitality. So let's say you got hit in the face with a baseball when you were a kid, knocked out your 2 front teeth. That's going to put stress on the kidney and bladder meridians and could make you a little bit vulnerable in that area. Now, when a tooth goes bad, is that because the kidney or bladder were struggling a little bit and the tooth didn't get the full energy flow that it needed? It's kind of a chicken and the egg question. We don't really know. But we do know that when you have trouble with one tooth, you have to take a look at, well, what meridian is that connected with and what should I look for in the rest of the body? So that's the first 4 teeth. Then as we come out, we get to these pointed teeth here, and these are liver and gallbladder teeth. So again, when you have trouble with these teeth of any kind, let's say maybe you have a root canal there, something like that, this can cause stress to the liver and gallbladder. If the liver or gallbladder are having trouble, it can cause you to have a problem in those teeth. Sometimes people have teeth that don't come in properly. They're crooked, or maybe they don't even descend all the way like they should. Again, in biological medicine, we look to the organ associated with that and say, hey, this is going to have create a vulnerability, in that organ. Then coming out to the next series of teeth here, these are related to the lung and large intestine meridian. And again, if you have trouble with your lungs, trouble with your bowels, it can reflect as a vulnerability in those teeth or vice versa. Now, an interesting one I found when I was studying biological medicine is the connection with these teeth on the spleen and stomach meridian. These are number 26 and 27 on the top, number 34 and 35 on the bottom. And again, you can get a chart like this yourself to kind of look on and compare to your own teeth. But my classes were taught by Dr. Thomas Rau, who was the medical director of the Paracelsus Clinic in Switzerland. And they are a huge biological medicine clinic. They treat cancer patients. And he found very interestingly that because the stomach meridian in Chinese medicine is associated with all things female. And he found that when there were root canals or mercury fillings in these teeth, there was a correlation with breast cancers. So again, it's a good idea to just realize it doesn't mean this is going to cause breast cancer if you have a root canal in that tooth, but it does create a vulnerability factor. How you treat your dental condition is very important to how your body is affected by that. But I thought that was very interesting with the stomach meridian tooth, that he would find that correlation with breast cancer, multiple times. And then the final teeth that we'll talk about here are the heart and small intestine. Those are in the very, very back. Those are the very last teeth on the top and bottom. So it's fascinating to look at these interrelationships. I highly suggest you pull up a chart online and then look at your own teeth and just say, hey, where do I have a giant filling? Where do I have a root canal? Do I have gum disease? All of these things that go on in the mouth have a huge impact on the body. And if you want the absolute best solutions for your health from a dental perspective, search out a biological dentist. Look for the IAOMT certification and be sure that you're working with somebody that does understand these interrelationships between what they do in your mouth and how that can affect your body.